live now. Hi, guys. Hi, everyone. Welcome to another Blue Circle Diabetes Foundation Sunday workshops. And we will be continuing our series on living with diabetes across the globe. And today we have a very special guest, our lovely, my dear friend Anita. She's here. And
Hi!
so we'll just chit chat for a bit and we'll let a few people join in and we can start in about a minute. And me and
Sure.
Anita were just having a very interesting conversation on, languages and desserts. That's so interesting. I find it very interesting and insightful. And I'm not sure if you know or I've told you yet, but I'm learning Korean.
Ah, I cannot learn the Hangul one. It's just too
Uh,
complicated. It's like round
if you
and
know
around.
Mandarin,
You
if
can
you
do
know
it? You can do the
Mandarin, then
Hangul?
Hangul is very easy if you know Mandarin, yeah.
Oh,
Yes.
oh. Okay, I prefer Mandarin.
The tough life. You like the tough life. Yeah. Okay. So hi everyone, hi guys, and we'll continue this fun chit chat and get to know a little bit more about Anita and how she's managing living with type 1 diabetes in Indonesia. And if you guys have any comments, let us know in the comment section and we'll take them up, as and when we have some time. And if it matches what we're talking to, we'll take them up. But let us know where you're watching us from, where you're listening in to this workshop from, and let's have this conversation started and takes this discussion ahead. So Anita and I have known each other, I think, virtually for a really long time, and we have met a couple of times in person.
Yeah.
Yeah,
I think the
and
first
I've
time
always
in
been
Rotterdam,
inspired
right?
by yes, Rotterdam, and then
During
I
its
think
start.
in Singapore. I think yeah.
Yes.
And what I was saying is, I'm always inspired, like by your story and how you're managing the condition. And I know a few other conditions as well, and the social challenges that we have spoken about in Indonesia. So we'll get a lot into it, and but before we jump into that, I would like you to introduce yourself, give us a brief about yourself, and how long you have been T1.
Okay. Hi, everyone. I'm Anita Snehal from Jakarta, Indonesia. I live with type 1 diabetes for almost 28 years. I'm a mother of two boys. I'm a patient advocate. And this is prize one. I'm currently pursuing my PhD. Yay!
Oh my God, this is amazing! Congratulations!
Crazy, right?
Yes. How are you finding time to do so much?
I have no idea.
That's amazing. That's amazing. Kudos to you. Yeah. Yeah.
I'm really excited.
Yeah, we are too
Yeah.
now. Yeah. And how long you are 21?
28 years. For 28
28.
years. So, yes.
Yes. Yeah. And you were diagnosed when you are how many years? How old were you?
I was diagnosed back in 1997 when I was 13 years old.
Oh.
So it's interesting. Why? Because I show the classic symptoms of diabetes. I went to the toilets a lot. I have a skinny body, and then I got thirsty a lot. Um, but back in the 1990s, people doesn't really know understand about type 1 diabetes, and I'm a girl, so people thought that as a girl and I have a skinny body, it's okay, it looks good because it looks good because you can use any clothes you want to wear because you're skinny. But that's completely wrong.
I know.
It's not skinny good; it's skinny type 1.
Right.
Yeah, so it doesn't ring a bell,
Hmm.
unfortunately. So when I was finally diagnosed with type 1 diabetes and my doctor recommended me to use insulin, since due to lack of awareness of type 1 diabetes, my parents decided to take me home without insulin.
Oh.
Um, it's I think it's part of my darkest moment because because when I'm type 1 without insulin means that you're
Yeah.
you
Dipping
you
down.
get weaker and weaker and weaker, and I was bedridden for days. um, that's when my father finds out, and and finally took me to the hospital to have my insulin shot. And I still remember that at that moment he said, Anita, you have to measure everything yourself because no one understands. And I was a teenager. I'm 13. And I feel really clueless because I don't know where to go. Even my parents don't know how to manage my diabetes. So it's a lot of challenges at that moment. So that's why I'm really happy nowadays. I mean, we have this connection, we have the peer support, the community, all platforms available. So I'm really, really grateful for nowadays.
Yeah. And what you mentioned about, like how, especially for women, like young girls, it's considered so good that you're getting skinny. Like I was diagnosed when I was 11. Yeah. And I was always a plump kid, like, and my parents were feeling like, oh wow, she's losing so much weight, and like it's such a good thing.
Yeah.
It's we have to look at
No,
the other side of the story also, right? Yeah.
it's not a good sign when you just lose weight. Yeah.
Right, right. And when you were diagnosed, like what kind of insulin were you put on, and how was the whole journey for you to accept that you are now someone who's living with type 1?
I'm using the mixed one, the mixed insulin. I still remember it's on the vial. It's on a vial, and I'm using this kind of silver pen. I put the vial inside, and it's old school.
Yeah.
um, but and since junior high until college, I never met any type one. So I think that's why I told you that probably that my darkest moment because I feel really lonely at that time. I don't know where to go. I don't know where to ask. I just do things like a robot. I mean, inject a without, even I don't even check my blood sugar because I don't have the glucometer at that time. I have my first glucometer when I was in college,
Mm-hmm.
and so do you know what I did to check my blood sugar at that when I at that time because I don't have a glucometer. So I had my blood sugar checked through my veins every 2 weeks, and
No.
it's a small clinic next to school. And sometimes I
Right.
got bruises because of too much I mean blood drawn every 2 weeks. All those so that's why I told you it's the darkest moment.
Yeah. 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 Things we had to do, right?
Yeah.
Yeah. And at that point of time, like when you were diagnosed, like you said, you didn't meet anyone else, and like it was really difficult. But how was the support from your parents or relatives, or like did you tell anyone, like your closest friends?
No, cannot. I cannot because I at first I was angry with my parents, but
Mm-hmm.
now I realize the reason why. So when I was diagnosed with diabetes, my parents asked me not to tell anyone about it because they fear that people will treat me different. But also at the same time, when I was a kid, the stigma also fell to the parents. I just realized that my mom, whenever she went out from home, the neighbors will blame her because they thought that my mom must have treated me wrong or feeding me wrong. That's why I developed diabetes. So it's just the dominant effect of the lack of awareness of type 1 diabetes. I mean, not only fell on us, it also fell to our parents as well. So that's why now I realize why my parents asked me to hide my condition at that time because um, stigma is cruel, especially when you're a mother. And I mean, yeah, because I'm also a mother. I mean, I cannot imagine myself. I mean, I'm a mother. I will do anything to protect my kid. But when my kid is sick and people around me blame me for it, I will be really devastated as well.
Yeah, yeah. I think with you, Anita, like it's interesting to see that transformation on how when you were a kid and like you did not understand what your parents were thinking, and now when you yourself are a parent, and then you see from the other side the lens of a parent, and it's interesting to see that. Yeah.
Yeah.
Yeah. And I mean, I'm not sure if a lot of people in the community like are active in like the global diabetes networks, but Anita has been a formidable force in terms of the diabetes awareness, and bringing the required education in Indonesia overall, and definitely will touch a lot more on that, because I remember her talking so passionately about the challenges they are in Indonesia. And I know you were talking about how you went from island to island, and educating people and things like that. uh, but before, like, we want to focus right now, the first half of the session, onto you, you know, and now, like, now that you are an diabetes advocate and you speak globally on different topics, what does your day look like?
It's interesting. So I have ADHD. It's a neurodivergent. That's why people told me that, Anita, why you're so structured? Because I answered, I need structured so I don't mess with my diabetes management. So, so every time I wake up, I check my blood sugar. If it's high, I did correction, and then I prepare my breakfast for my family. When it's almost done, I wake my kids, and kids ready for school. They're off to school. Then I start my morning run, and then going back after my morning run, I had my coffee, I had my breakfast, I did my blood sugar check, so on and so on and so on and so on. But it's really structured. I even remember the time. So kids off to school at 7. I have my morning at 9. So if I have any work to do, I usually bring my laptop with me. So I went to my nearest coffee shop and I start working at 9 till 11, and I go back home. So it's really structured. Why? Because I think I would like to highlight a bit about my neurodivergent because I met parents with neurodivergent kids, also with type 1, and they seem really overwhelmed. But yes, and I also believe that it's only in the beginning. But when you can provide the structure for your kid and the kid followed, and if you remember highly in your kid's brain, and they will follow the structure as well. That's where you will find out that your diabetes management won't be messed out because the kid will follow the structure that you've made for them.
Right,
I but
right.
don't think I'm crazy for some.
No, definitely not. And like, even me, I want to be very organized. Like, and sometimes I feel like, like, am I doing too much? Because everything has to be organized, everything has to be in its place, and
Yeah.
like, all
Yeah.
the messages have
Right?
to be read. My email box has to be like read and like, cleansed through. Like, it cannot be just
Yes.
left unread. Like, and sometimes and you see people around you, like, where you're like unread messages and unread emails, and like, just things just piling up, and like, I cannot be that person.
Right? And I think we do need that structure. Why? Because we don't want to mess our diabetes management. Because you can imagine that if our email is messy, and so we're busy scoring all the emails, how long will it take? Will it take away our time to measure diabetes? I mean, we think a lot about it, right? So I think it's just like it's just part of our structure.
Right, I feel you. I feel you. Yeah, yeah. So currently, are you using syringes, or like pens, or are you on a pump?
So I'm using pump in weekdays, but but pens on weekends because as a woman, we like to dress nice, right? And sometimes pumps limit
Right.
our choices. That's why and also we have family events on weekends. That's why I decided to have my pumps off on weekends, so I can go back to my multiple daily injections, so I can use nice outfit,
Mhm.
nice dresses.
Nice. It's good to know, because sometimes you feel like you're stuck with something, but you have the option,
Yeah.
like you said, that's very
Yes.
important. Yeah.
Yeah.
And do you wear a CGM also?
Yes, I'm using a CGM. Yeah.
Which one?
I'm using the. Is it okay to mention brand?
Yeah.
Okay, it's
Yeah.
okay. I'm
Okay.
I'm using Otai brand. Yeah.
Okay. Okay. I've heard. I think Lenny and I think Cheska also talk about that. They are in the Philippines as well. So
Yeah.
uh, so they have also been like, I've heard that brand from them. I have, like, it's not in India, but it's
Ah.
interesting to know, like, different brands which are available. Yeah, and
Yeah, and
overall,
it's really
Mhm.
affordable. I mean, compared with other brands, I think Otai is
Right.
most affordable compared with other brands. And also there's some brands that I'm allergic to the adhesive. So, but I'm like with this one, I'm good. So it's yeah.
Okay. Okay. And overall in Indonesia, what would you say? What do people use the most? Like, are they or MDIs or pumps, and do they use CGM or not?
Okay. So if you going back to Indonesia, um, so you're talking about Indonesia National Insurance. We covered insulin and medicines, lab work, and doctor consultation, but not diabetes technology, such as pumps
Okay.
or CGM. It's not. But we're going
But
really going to the basic because
uh,
we're covering 20.89 million people with diabetes across the country. So
okay.
it's a lot of number. And I remember that during the audience at the parliament, they answered, we prioritize life saving things first. So I agree with them.
Okay. Okay. And like, if you're diagnosed with type 1 and you go to a any healthcare facility or a hospital, like, do they immediately put you on like the insurance, and like you immediately get the free insulin and stuff, or like you have just like a waiting period?
So actually, our national insurance will publish once you're coming to this world. It's a compulsory. So
Mhm.
so you will have your national insurance covered. But when you're diagnosed with type one, and you have to know that we have a very large geographic country with limited numbers of resources, so we need to have the children newly diagnosed to be referred to the bigger hospital or to the national reference hospital, so they at least they can have the first hand education about type one diabetes, and that's still a homework for us.
Okay. And like, do a lot of people use pens or syringes or pumps?
Most of them are use pen.
Pens, yeah. And CGMs, like, do
Yeah.
a lot of people use CGM?
CGM, although it's available in the marketplace, but it's still pricey. It's still costly for some people. So most of them are still using strips. Because strips also
No.
not covered by the insurance, but we have
Mhm.
projects to provide strips.
Okay, okay. And are there any, like, specialized diabetes clinics in Indonesia, like where someone can go, or, like, get their checkups done?
Yes, we do have diabetes clinics, but only in private hospitals, not in
Mhm.
national hospitals. So
Okay,
if they opt for a diabetes clinic specifically, they need to go to the private ones or out of the pocket cost instead of the national ones.
okay. There's one question. Which insulins are covered by the government hospitals or insurance? Like, are there, like, do they cover something like Fias, Lower Rapid, or is it like something like Actrapid?
Actually, we have our own local manufactured insulin. We
Mm-hmm.
have three brands from Kalbe Pharma, Bio Pharma, and Sanbe Pharma. It's
Okay.
our local manufactured insulin, and it's much lower in cost. So and I think it's a good thing. Why? Because we have more budget for the rest of the medication that may link with diabetes. Because diabetes is not working alone. They also input other organs as well. It's a good thing.
Okay. But then, is this the rapid acting, or the ultra rapid acting? And it cover, like, the government insurance, does it cover all the types of insulin?
Yes, we also have the private ones also provide the imported ones insulin.
Mhm.
So actually, you have options if you want to have the imported insulin. You can go to the private hospital, but if you're okay with the local manufacturer, you can go to the national hospital.
Okay. It's interesting to know that, because local production of insulin will definitely be cheaper and, like, effective
Yes,
as well. And
yes, a
like,
lot.
and it reduces the financial burden so much, like, on people who are living with the condition.
Yeah.
Yeah. Yeah. and tell us a little bit more about your work, like your community in Indonesia, and like what all activities do you do?
So we have several diabetes community, but based on age. Because like for
Okay.
children's diabetes, children and adolescents, we call it IKADAR. It's a Children with Diabetes Association. I'm the vice president for IKADAR. We're focusing, but we also collaborate. IKADAR collaborate with CDIC Indonesia, and I work for Diabetes Initiative Indonesia, the ID for Women's Project, and also with Persadia. But outside of the three major organizations for patients, we have for educators. We have two diabetes organizations for educators, PEDI and Sobat Diabet. The interesting part of Sobat Diabet is most are young educators because mostly they are focusing on how to manage diabetes in their family for their parents. So it's a really interesting dynamic. We have the same purpose. It's regarding diabetes education, but they're coming from different backgrounds. Some from educators, young educators, patients in different ages. So it's really interesting to have this kind of conversation going with them because the dynamics and it keeps on evolving because we have the same purpose for better diabetes management in Indonesia.
Yeah, it's interesting. Yeah, in the age-wise, like age-wise
Yeah,
segmentation is really cool. Like
yeah,
because someone who's quite young or maybe who's a teenager may not want to talk, like with someone who's quite senior or like who's had diabetes for a really long time. Yeah. Yeah.
yeah.
And what would you say are the challenges that you face, like when you meet newly diagnosed kids or like or people who have been living with the condition for a long time? What are the challenges that you notice?
For the newly diagnosed, probably it's about education because, as I mentioned earlier, the Indonesia is a very large country. We're consists of 17,000 islands, but most of our healthcare professionals are endocrinologists located in five major islands, only in Sumatra, Kalimantan, Java, Sulawesi, and Bali. Well, we have 17,000 islands. Um, so as a newly diagnosed means sometimes the cost of transportation is bigger
Mhm.
than
Right.
the medical cost, and it's way bigger because you can imagine once there's a case where there's a parent, a mother, she shared her concern that she's running out of glucose chip for her daughter, and because of our unawareness, we recommend her, why don't you find the nearest pharmacy and buy strip there. And she answered, I can't because she needs to take a boat for a night to the nearest island that has the pharmacy. And it struck me why, because the challenge is really not only, it's not about medication anymore. It's beyond medication. It's about cost on getting your supplies. And it's I just like, I wish I could do
Heartbreaking.
something or being a Harry Potter or do something. Yeah, but it's really difficult because I mean, yeah, we really challenge in geography condition.
Right, right. I think the logistics part of, like ensuring the medication reaches to someone who needs it is a little difficult to me. Yeah.
Yeah.
And I know you were also telling me, like, like last when we met, like the different islands also have, like their different social challenges also, like in accepting the condition. And
Yes.
then, like you said for yourself, like do parents really support insulin once you're diagnosed with type 1? Yeah. Yeah.
Yeah, it's really interesting. So Indonesia, if you talk about the political background, Indonesia consists of 70,000 islands and 38 provinces. So these provinces will have a health budget that need to be managed. So it will really depend on how much people with diabetes in your province, because it's the same budget, but you have to share.
Mhm. Right.
So you can
Right.
imagine the struggle, because you can imagine that if there's one province with a lot of type ones, so it means that you have only limited number of pens because you have to share the budget. It's for
Yeah.
political, but for socioeconomic, that we have 1,341 tribes across the country with 700 local languages with different cultural cultural backgrounds. In terms of diversity education, I cannot carry myself as a person coming from Jakarta. I need to mingle with I have to collaborate with the local community. So that's why my women's project that we're doing for the last 3 years, we always collaborate with the local government, local endocrinologists, local health communities, local patients. Why? Because they understand better about their environment. So we can only carry our guidelines, but they're the who will distribute the information. Why? Because in that way they will understand more because it's more understandable because it's from your community. And also we're also providing them a safe zone. Why? Because they know where to go if anything happens to them, because they know their local community, their local government, their local health professionals, because they understand and they learn along with us.
Yeah, yeah. I think it's a little bit similar to India, because India is also like a vast geographic location with different languages and different dialects and like different customs. So each area will have like a different, like a socio-economic challenge, and you have to be on the ground and speak the local
Yes,
language for them to, understand.
yes,
It makes it a little difficult if you are, like if you cannot speak the language, then they wouldn't trust you to get, like to
true.
listen to you.
Yep,
Yeah.
yep, definitely agree. Yes,
Yeah, I think that's. I mean, we have spoken to a lot of our friends also, like from Japan and Philippines and like Hong Kong, and this kind of little bit of like a social challenge in accepting the condition and like taking insulin and like believing that insulin is the only solution. It's a little tough to kind of accept that. I think that is one thing I've noticed in common across like all the Asian peninsula in terms of like how people
yes,
accept the condition, like or any kind of a non-communicable disease. It's difficult to kind of accept, and definitely the financial burden and like the stigma around it is there, but self acceptance is also a little like challenging. Yeah.
yes, definitely.
And I know, Anita, you speak a lot about like the stigma and like and especially for women. I know you work a lot for different
Yes.
women initiatives also. So would you like to speak a little bit on like how you handle, like, especially for a woman who's living with like type 1 diabetes or any other form of NCD, and the stigma that they deal with?
Yes, it's a special topic in my heart because as a woman with diabetes with chronic condition, and we're coming from Asia, and we know that the stigma is there, that it's really hard to tackle. Why? Because actually we are dealing with layered of stigma, stigma as a woman and stigma as a person with chronic condition. I know growing up with chronic condition, and I'm a girl, people will see me as you're not valuable
Hmm.
because I mean, in my tribe, a girl expected to be at home, just cook, clean the house, do
Yeah.
the housework. So when I decided to pursue my higher education, the society asked my family why Anita is sick, but I really grateful that my family believe on have to have a trust on me so I can pursue my higher education. And then also when I so because we're growing up with diabetes, people thought that I cannot have kids. So I will
Mm.
always have this like black label on me that don't get close with Anita because she cannot have kids. Don't get close to her. Even in some tribes, a Japanese tribe, we call it bobot bibit bebet. Bobot means uh, they will consider your status. They will also consider your health background. They also
Hmm.
consider your economy. And in terms of health background, I'm not. I don't fulfill that part because
Right.
I live with diabetes. So, and it's interesting because my husband coming from that tribe. so, So it's a huge challenge for him to convince his family marrying me at the time. Stigma growing up with diabetes, and then stigma when you got married, and people thought that you can have kids. But when you have kids, the stigma also appear. Why? Because they thought that you cannot be a good mother. Because there are some situation that made me feel that I failed to be a good mother. So I developed preeclampsia, so I have to give birth to my kids premature. And then I cannot breastfeed my kids because every time I breastfeed my kids, I got into major hypo. So in a certain society, when you are unable to breastfeed your kids, they will think that you're a bad mother. So it's a lot of layers of stigma
Yeah.
happening. But there's one key message is that you are the most important person for your kids. You know what's best for them. The reason why I don't breastfeed because I want to live longer. I don't want to run into a major hypo. I love my kids, and that's why I'm trying to survive as long as I can.
Yeah.
So I
And
think,
mhm.
yeah, yeah, I think people need to understand that.
Yes. Yes. And I can see, Anita, like you breaking all the barriers when people said that, like maybe you cannot do higher education and you went and you did that, and then you cannot get married and you got married, and then they said you cannot have kids and then you had kids and then you had two boys, like, so it's important to see that, like you are not held back from what society puts the stigma that society
Yes,
puts on you, because you can definitely cross the stigma, cross the barriers, and you can do better. But I know it's so difficult on you emotionally, to deal with all of this, the constant questioning, and like the constant murmurs that you listen, people talking about you, and then and no matter how hard, like you try and you beat all these things, and you still come out, like as a winner. There's still someone else who will be speaking something about it, like,
yes,
so it can be very challenging. But I think as women, it's very
yes,
important to share our stories, like to bring out what we have gone through, and like how we have done it, and like it was not never an easy journey. Yeah.
yeah. Just
And
focus on yourself.
Nupur asked a
You are
question. I know you
valuable.
talked a little bit.
Yeah. Which question?
Yeah, yeah, you're valuable. I think that's an important lesson. Yeah, that's an important lesson. Yeah, and a reminder also. Like, because I think as women we keep on forgetting that, like you are important and you are valuable. Like
Yeah,
your life is not dependent on, like to be just like someone who cooks, or like someone who takes care of the house.
yeah,
Like that.
yeah.
Yeah. And I know you touched a little bit on, like ADHD. And
Yes.
so if you are okay to share about it, like do you take meds for it? And, like, are there other kids with ADHD and type 1, and what is their journey like?
So it's interesting because I was diagnosed late because I learned that I have because I had my assessment after my youngest son had his assessment. So my youngest son had his assessment and he was diagnosed with ADHD. And then the doctor, the psychiatrist told me that it's hereditary, or whether it's mom or dad. So I told her, so let's let's just check mine, and then turns out I have ADHD. But we're in a
Oh,
different level because my son he needs therapy um, and shadow teacher in his school. But I can manage myself better. Although I think it's about I know what to do if I had a crash. I don't know whether you remember or not. In IDF Bangkok, I had an ADHD crash actually after a session that I moderate.
mhm.
I know I was overwhelmed with the lights, with the voice, with the sound, with the people around me. That's why I decided. I told Mark, Tino, and Lucy that
Yeah.
I need to go back to my hotel right away. And the hardest part when you have autoimmune condition, when you have ADHD crash, it triggered your autoimmune. So just in a matter of minutes, I got fever and I have my joints all hurt, aching joints, and I know my blood sugar is rising because I have ADHD crash. I need to I need to calm myself. I need to put my emotion down, and it's real difficult when you're in a different surrounding, in a very hectic environment. So I was really lucky. I have supportive friends around me at that time, and they helped me. I know Mark took me back to my hotel so I can call myself because it's just too much in some point during the conference. The light, the noise, the people, it's too much for me. Yeah, so it's really difficult to manage sometimes.
Yeah. Okay. Can someone let us know Okay, let me know if I'm audible, visible now.
Yeah.
Am I audible?
Yeah.
Okay, okay, perfect. Okay, great. Sorry about the technical glitch. Just keeps on. If you're having an interesting discussion, the technical glitch happens to be. Yeah. Okay. And Anita, I was just saying that thank you for sharing your story, like because I know it can be difficult, to share your vulnerable moments as well with the larger audience. But I know a lot of people keep silent about having other conditions as well, like because type 1 diabetes itself feels so overwhelming that if you have other
Yeah.
conditions, like a lot of people in our community, they have celiac plus type 2, and more often than not, they just talk about one condition and not the other. you know.
Yeah.
And it's important to know that you as an individual, you have to manage all the conditions equally well. It cannot be just focus on one and not the other. Yeah.
Yeah, but
And
I think it's
other than that,
important to
like,
know that. Yeah, but I think it's also important that I mean, I'm not the only one with multiple condition. I know out there are people with multiple conditions, and we're still having gaps in terms of guidelines about it. I know that we still have no guidelines yet about ADHD and type one complications. There's still gaps, and we need more people to speak up because we need that. I mean, I think I don't want people with like us in the future still have that gap because
yeah.
it's not it's just so wrong. I mean, doing things without guidelines, it's just like you're doing trial and error all the time.
Yes. And when all of us before, like have done the mistakes and, like learn from our
Yeah,
mistakes, and we want people not to repeat the
yeah,
same and, learn from
yeah.
our mistakes, right? Yeah.
True,
Yeah.
true.
Um, So we spoke a little bit about, like how the stigma around women living with, like type 1 diabetes. But have you also noticed stigma in different situations, like, like getting admissions to school or, like workplace? Like, do we see stigma in those situations also?
Yes, yes, yes. Why? Because in terms of school, I think it really it depends on how we advocate, because there are some cases of kids and parents ask for our advice when they want to have their kids enroll to school. They ask us on what to do. So we have a team visiting the future school, and we advocate about type 1 diabetes and asking for ways. I think the reason why school hesitate accepting type 1 because they don't know what to do,
Yeah.
what to do if hypo happens, what to do if hypoglycemia happens. Because they don't know what to do. So instead of putting every responsibility to the school, we try to find a solution, probably like providing a school nurse or collaborating with the nearest healthcare facility around the school area. And those things are able to be conducted or in school settings. So I always believe that it's not about discrimination; it's about lack of awareness,
Awareness.
lack of awareness. Yeah. Well, for workplace, workplace is difficult because if you put yourself as an investor, you want your business to work well, to run well. You want everyone to be healthy. So that's why let's try to provide that environment instead of blocking someone because of their health condition. So I think it's about on how we communicate our health condition to our employer, um, because I think it's the misunderstanding, because people thought that having diabetes means that you don't have the competency of working, which is totally wrong. So the question is, how will you change the mindset of your employer? That will be the question. When I work in the oil and gas industry, I'm the only female in that department, and I
Okay.
have type 1 diabetes. In my first year, I did hide my condition. I took my injections in the classroom. I treat my hypo in the bathroom. No one knows about my condition. But after I got promoted, that's where I decided to speak about my health condition with a message that I have the same competencies like normal people do. I just need a chance to prove that you are wrong.
Yeah, I agree.
Yeah.
There's another question. Are there a lot of different languages spoken in Indonesia that would make the diabetes education a little bit difficult?
Yes, we have 700 local languages. we have we have 700 local languages.
Wow.
That's why it's
Yeah.
really challenging. Even like in the same island, like Java Island. I'm from Betawi tribe. We have our own language, but when you move a bit to the West Java, they use Sundanese language. We move a bit to the Central Java, they use Japanese language. Even East Java and Central Java, although they come from the Japanese tribe, they have different level of languages. They have like
Right.
three level languages. So the soft ones, the regular ones. And it's like I cannot do that. I need someone to help
Yes.
me.
And
It's really
at what
challenging in
point?
terms of language.
Yes, yes, definitely. And the next, I think, coming to everyone's favorite topic is food. Like, uh, so what about Indonesian food? Like, is it carb heavy? Is there a lot of sugar? And how do you manage?
It's carb heavy for sure, because we're Asians. We eat rice. We eat rice, we eat noodles. Um, even like in parties, if you there's a even in weekends we have this special menu. We call it nasi uduk. So it contains of rice with vermicelli and fritters coming from flour, which is like carbs, carbs, carbs.
Yeah.
But it's I mean, so but it's the one point is that when you said no to a newly diagnosed, they will be stressed out, right? So all you can do is remind them portion control. You can still eat food that you like, but you have to be mindful on the portion. Because when you said no from the start, they will be stressed out. So you have to negotiate with the newly diagnosed. And in terms of cultural, so there's a different food fragments in islands. Like in Sumatra Island, most of the foods are using coconut milk, but in Java Island, most of the foods are sweet. Why? Because back in the colonial era, Java Island is a sugarcane plantation, so they use any meal with sugar. So you have to be cautious about that. Even like when you eat soup, it was sweet. It will be sweet. So you have to be ready. But I think yeah, it's really interesting. Why? Because um, I think it made us be wiser towards our own culture, especially with diabetes. Because as we know that most of the diabetes book, nutrition book, are based on the Western menus. So you have to think, what if we bring back those books to our country? Is it applicable? Will be understandable by our community? So that's where the our homework starts. Why? Because how to make people with diabetes understand about nutrition if our books are based on the Western menu. So we need
Yeah.
to go local. Yeah.
Yeah, definitely. Nupur is also saying that when she was recently in the Philippines, and even in Philippines, a lot of food had, like a lot of sugar.
Yes.
Yeah. And what's your
Yeah, but
favorite
yeah,
dish?
but my favorite dish. I love exploring food. I don't know if you know Edith, right? Edith from Edith Musantuari from Nigeria,
Yeah, yeah,
Uganda.
I know.
Yeah, yeah. We do talk a lot about food and nutrition with her. Why? Because again, most of the books on nutrition based on the Western menus. While but if we put ourselves in our local perspective, actually our local menus are trying their best to provide the same nutritious um, for others. And interesting fact: do you know? You do know that autoimmune condition related with vitamin D deficiency, right?
Mm-hmm.
And there's a tribe in Indonesia who have a genetic mutation unable to transform the morning sun, into vitamin D.
Wow.
It's a genetic generation, so we cannot transform the sun into our vitamin D. But in the same time, we have this fish named ikan kembung, which contains 600 units of vitamin D.
Okay.
So So I think we need to look closer, especially on
Mm-hmm.
our ancestors' menu. For example, like collagen. I think it's famous in ramen with collagen for skin and such.
Mm-hmm.
But in Indonesia, we have our local dish using cow joints because it's rich with collagen. So
Okay.
it's really interesting. I mean, yeah, I
Yeah.
mean, thinking on how our ancestors trying to provide a nutritious meal for us. Actually, it compensates um, nicely with the Western recommendation.
Yes, and that's a very interesting take, because more often than not, I think Asian countries always try to follow what is popular in the Western culture, which may or may not be applicable to the Asian, like Asian surroundings and, like Asian conditions. And like you said, like the example of the fish that you gave, like the solution may be closer to us than we think.
Yeah, 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 and I think it's more sustainable. I mean, you can imagine that if we went to the village and we talk about nutrition, and we could ask them to please visit the nearest supermarket to buy this and this and this and this. No, we cannot do that. We have
Yeah.
to get closer to their market, what's available there, and then we can educate them about what's the nutrition available in their place, in their village instead.
It would be very local and like
Yes.
near the place to make it sustainable.
Yes. Yes. True. Agree.
And what are your hobbies, Anita? Like, what do you do in
Ah,
your
you
free
know
time?
me well. I love baking, drawing, writing. All good things. So I used to have a culinary business. My
Mm.
record is I baked 20 Christmas cheesecake in one day.
Wow.
That's my
I
record.
didn't know this. I didn't know this about you.
And I bake a lot of especially traditional cakes, Chinese cakes. So we have this traditional cakes named Kue Tok. Tok, you know, tok means,
Talk
so
is rice,
it's
rice cake, right? Something made of rice.
yeah, it's made, yes, it's made of rice flour.
Yeah.
And the reason why it's called Kue Tok, because after we put the dough in the mold, we need to we don't do tok the
Okay.
mold
Yeah.
into the table, so it creates a sound tok tok. So that's we
Okay.
call it Kue Tok. Tok cake.
Interesting.
Yeah, and I was like, whoa. And it's a Chinese traditional cake. It's usually made during Chinese New Year. It's red. It's a tortillas mold.
Mhm. I've seen a lot of, like the pictures of, like various Chinese desserts, and I have never had the chance to try
Yeah,
them, but they always look very interesting.
yeah. They have there's a lot of history and message around that, because like like uh I don't know what you call it. It's bun, steam bun. We call it
Mm.
ba bao, bao zi.
Wow. See.
Um, it's made of tang mian flour, but back when Chinese ancestors coming to Indonesia, it's not available, so they combine with flour. So now we call it as ting bread. It's in
Okay.
Singkawang in Pontianak, Kalimantan Island. So it's interesting here and there, but it's just good to know.
Yeah. Yeah. And is there any kind of like a cultural significance living in Indonesia and living with type 1 diabetes that you felt was like no one else would know, like no one else other than Indonesians would know about the cultural significance and type 1?
Hmm. I think it's about perspective. I know, like in
Mm-hmm.
some countries, I mean, I also know that, like in India, I mean, you have this campaign, inject yourself anywhere, but
Yeah.
not in here, not yet, not yet. But I know, even my son and my boys, they're protecting me from the perception, because whenever I inject myself in public, my boys will stand up and cover me as my
Yeah.
bodyguard. They don't want people to see me in my being vulnerable. But I think, um, yeah, because there you go. You have to have the perspective, because people, as a mother, as a woman, people want you to be strong, never got sick, because you have to take care of your family. So when you inject yourself in public, I mean, hey, you're sick. You're a mother. You're not supposed to be sick. But what
Yeah.
if I'm sick? I mean, you're right. It's a huge mindset that needs to be changed. I mean, it's okay to be vulnerable. I mean, but I survived. It's okay. But yeah,
Yeah.
I think it takes time. It takes time. So I really appreciate your campaign about inject yourself everywhere, because yeah, but in some point we do need to find understanding with the society, that it's okay to be vulnerable. It's okay. You do survive. You're just fine.
I know you had put this story on LinkedIn also about how your boys just try and like try to protect you, and Nupur is saying you have the cutest bodyguards.
Oh, they're lovely. So we went to this amusement park, and my youngest, he asked me to buy a cotton candy. I thought it's for him, so I bought the cotton candy for him. But along the way, he always carried his cotton candy without eating it, and I asked him, "Why don't you eat it?" And he said, "It's for you, mom, if you got a hypo." So it's not for him, it's for me. So he's carrying the cotton candy everywhere for me. So I mean, it's wonderful to see how our family being their best support for us.
Yeah. Okay. Okay, I'm here back. Sorry. Why my
Hi.
Wi-Fi? I don't know. My Wi-Fi is acting crazy today. Yeah. There's one question in the chat. What are the commonly available and used glucose monitoring devices in Indonesia?
Okay. We're still using glucose strips. We're still using glucometer. Is it okay to mention brands, right? So,
Yes.
so apologize first. So, since we have a CDIC Indonesia project, so for type 1 kids, their glucometers are branded with Roche EcoCheck because they're strips covered, distributed by Roche. But they also have a lot of Chinese brands such as Sinocare, One Touch. But I think the most cheap one is Sinocare. Um,
Okay.
we do try to advocate for strips for Indonesia through our national insurance. So we count per strip. So it's like we count per strip cost times number of times we check our blood sugar, and then times number of type 1 in the country. So we have that number, and then we propose to the government. But
Yeah.
apparently, it's a long project because it's for the rest of our life. So they need to calculate back, recalculate again and again. So it's really challenging.
Yeah, but it's good to know that you have, like started with that this step one of, like giving the proposal ahead to get include this blood stress strips also in the
Yeah.
plan in the program. And we do have Sinocare in India as well, but not too widely used. But it's available in India also. Yeah.
Yeah.
And before, like it's almost, like time to finish our workshop today. It
I
was
don't
so
want
much.
to. I don't want
I
to. I just want to talk.
I know it didn't feel like 1 hour has almost passed, but before we let you go, Anita, there's like a fun rapid fire. So are you ready?
Okay.
Okay. So tea or coffee?
Coffee.
Okay. I know because I remember you had bought this the Pico, the coffee, different coffee flavored Picos, and they were amazing. I loved it. Yes.
I'm drinking coffee all the time.
Okay. Yeah. Cats or dogs?
Cats.
Okay. What's your favorite carbohydrate?
I love noodles, but I'm celiac, so let's go with shirataki noodle.
Okay. And what's your favorite hypo tea?
Oh, it's interesting. In Indonesia, we have sweetened iced tea in boxes.
Wow.
In boxes.
Uh,
Yeah.
yeah. Interesting. I would like to try that once.
Yes, we call it teh botol. Teh botol. Fine teh botol.
Okay. Who is your favorite superhero?
Hmm. Can I just have Disney princesses?
Why not?
Oh, I love Cinderella.
Oh,
Um, I love Cinderella. I love Mulan,
mm-hmm.
and I love Frozen. I love Elsa.
Yeah. I love Elsa too. Yeah. Nupur is saying she loves shirataki as well. I think Nupur was the one who introduced me to shirataki noodles, and
Ah,
they're really nice. Yeah.
yeah, really yummy. We have this noodle chain, and they provide chicken shirataki noodle. So good. You should try one. Come to Indonesia.
Definitely. What's your favorite emoji?
Mm.
The smiling one.
I'm doing the smile one.
What's your favorite hobby?
My favorite what?
Favorite hobby?
My favorite what? My
Your
hobby: baking and drawing.
Oh yes, I didn't know this about you, Anita. Definitely, this is news to me. That yes. And which is your favorite color?
Navy blue.
Oh, interesting. And one ice cream flavor you love.
Vanilla.
Okay. Okay, and we can keep on and on with this. Like the rapid fire. That's the favorite part of the workshops that we host.
And we need to have a
But
coffee chat soon. We need this
yes,
coffee chat soon. Yeah.
definitely. Yes, it was amazing chatting with you, Anita. Thank you so much. Like
So much
sharing your
fun.
story. Yeah, it was so fun. Yeah. Thank you so
Yeah.
much for joining us on a Sunday evening. It was fun chatting with
Thank you so
you.
much, Neha.
Yes, and thank you so much. Thanks everyone for joining us, and we'll see you again on next Sunday. Bye.
Bye.